Discharge, we have to see or any letter. First of all, we go to the writing task. After reading this writing task, we came to know that this is a letter of discharge, and you are writing this letter to the primary care physician. So, if you are writing this letter to the primary care physician, or if this is a letter of discharge, so we must have one thing in our mind that this is patient's GP, right? And why we are writing this letter? We can see over here that there is a discharge plan mentioned, few points that has been mentioned over here, and the assessment is that patient is recovering. However, his symptom can worsen if there is some. So now we can see from the top to bottom now and try to understand the case. Okay, try to understand the case. So basically, if I can ask you, if you are writing this letter to the patient's GP, right? So I can show you the same symptoms now. The patient was admitted with maybe schizophrenia, or this is the reason of admission. Okay, and we already have seen now the patient has responded well. That's why we are discharging. So this was the reason of admission actually. Anyhow, so you're writing this letter to the primary care physician. Do you think that should we incorporate this history or not? Next of kin, can it be written in this case or not? Is it relevant, semi-relevant, or irrelevant? We discussed yesterday. With reference to purpose, what is the purpose? The first person who is receiving this letter is the general practitioner, is primary care physician, and the issue is to follow the discharge plan. So, with reference to this issue, do you think that the next of kin should be written or not? Basically,
Yeah, it should be written.
so now you can see there when we are discussing the case. So the last admission detail was important. Sorry, the admitting details. Why? Because the patient self-admitted herself. Okay, and now you can see with reference to that, if the patient has self-admitted herself and you are writing this letter to the primary care physician, so the past history of hypertension will not be important, right? The past history of primary hyperthyroidism will not be important because we are writing this letter to the patient's GP. So he already or she already know this information. With reference to social background, unemployed is not important because GP already know. This is also not important. History of substance use. So, and only if you can see, if we are not writing this letter to the GP, these details would be quite important. But as we are writing this letter to the GP, no need to mention that. However, if you can see this history, last cocaine use. Now this is critical. The date sometime we do ignore that. Patient has had her last cocaine use a day before her admission because this is 28/2, and on the next day she self-admitted herself. So we should not miss anything. Normally, candidate do this mistake. Oh, okay, we are writing to the primary physician, right? So he already know or she already know the social history, so cut it down in total. So what we learned from this discussion is to always see the case thoroughly, either it's relevant or not, but see it so that you might not miss something that is very important. Anyhow, so now we can see the second point that is also important to be discussed over here. The patient admitted with this state like decompensated schizophrenia. So we'll see that medical background non-compliant with the medication. GP already know this thing if it's a behavior. Now this was the admitting complaint admitted for auditory command hallucination, telling patient to self-harm, weird hallucination, shadow figure with grinning faces, and whatever. So these are the symptoms that had been explained. So what we learn in today's class that in case of discharge letter, like we would say, symptoms are not important to be written. Why? Because if you can see now, the patient has good progress. Symptom would be important. Let's say when the patient was admitted in the ward for the psychiatrist, but now these symptoms are not important. So we'll try to summarize. One another thing that we discussed in the yesterday class when we were discussing about the conciseness said summarize the less relevant details. So with reference to discharge plan, this detail is less relevant, right? As the patient is already a diagnosed case of schizophrenia. So it's not the first time the GP is gonna see the patient, For that reason, no need to mention that symptoms because these were the symptoms when the patient were admitted in the hospital. So we can just write it down. He self-admitted herself with features of decomposition schizophrenia. No need to mention that thing. Even that, not need to mention that as well. Totally. We can write it down about the medication, right? He was commenced on antipsychotic medication, let's say, or he was commenced on risperidone, let's say, patient was, or we can write it once actually. The patient was managed with risperidone, to which he responded well, and there was no symptoms. Then we can write it down these things in our own language, right? Then separately, we can see there the next thing that is important for you to understand is the nursing management. Yes, we have to write it down. The way it has been presented in the file, it seems that this thing has to be done. Like it's not been managed in the hospital. Why? Because assess for objective sign of psychosis. We are confused. Redirect the patient from delirium. So either it has been done by the hospital staff or it has to be done. It's a very confusing thing. So basically, as you can see, it has been written before assessment. So logically speaking, it has been done in the ward. So we can write it down in terms of her nursing management. She has been managed for, let's say, sign of psychosis. Yes, she has been assessed for objective sign of psychosis, and the nursing management program also include that patient should be redirected from lineal thoughts, and it is also important to ensure her medical compliance in terms of nursing management. And she has been uh, encouraged to participate in the behavior control therapy as per need basis. So at the time of discharge, patient has good progress. We can write it down all this thing. And yes, we would explain the discharge plan. Risperidone, if it's a brand name, R capital. If it's a generic name, we should write it down lowercase. So we have to write it down this as well. And back to apartment, this is the instruction further to the GP that she has to arrange a follow-up with the mental health clinic, right? So we discussed in detail about the discharge letter. I hope somehow it's clear to you. Regarding the format of writing this task, it might not be the appropriate format in all of the cases, but regarding this task, if you can see, apart from the salutation and date, when we start the introduction, we can just give few things that she has responded to the treatment of schizophrenia, right? Yeah, she has been responding well to the treatment of decompensated schizophrenia for follow-up. So this intro has we should have two parts. The first one, the way the patient has responded to the treatment, and the second one is the follow-up, right? After introduction, in the next paragraph, we can start with the self-admission detail, like patient self-admitted herself with features of decompensated schizophrenia, and then please note that she had her last cocaine use, let's say, a day before her admission, or we can write it down this thing over here. Mr. XYZ, who has her last
Sir,
cocaine use.
excuse me, screen is the same on the last page.
In the introduction, we discuss like what would you write down in the introduction? We write it down two things. The first one is that patient has responded to the treatment, right? And second one is the follow-up. It would be in the introduction. Then we can next page, next paragraph, sorry, start from the extreme left, and we can start with the self admission along with the last cocaine use, vice versa. Mr. XYZ, who had her last cocaine use a day before her admission, when she self-admitted herself with worsening symptom of schizophrenia. Consequently, she was managed with risperidone, to which she responded well, like that. And there was no, let's say, hallucination and so on. You can write it down, these things after the risperidone point over here. Then, next paragraph, we can write down about the nursing management, right? And the last paragraph, we can write down about the discharge plan in the conclusion, right? So, this is clear to you. I will repeat the sequence for you again. So basically, first we will write down the intro in this case, where we mention that patient has responded to the treatment and follow up, right? Second paragraph, we can start with the last cocaine use plus her admission detail, but in summary form, not the symptom. Like she self-admitted herself with decompensated schizophrenia. Afterward, we write down about the management and then these points. Like she has responded well to the treatment as there is no history of hereditary or real hallucination now. Then the next paragraph we can write down about the nursing management and last is the discharge plan. I hope it's clear to you.